up, everyone? My name is Sydney. Welcome back to my channel. If you haven't been here before, hi, I'm Sydney. I am a sophomore at The Ohio State University. I am studying speech and hearing sciences with a minor in disability studies. And if you have been here before, welcome back. So I reached out on my Instagram at ChronicallySydney and asked, what does everyone want to see on my YouTube channel? Because as much as I want to share my own journey and my own experiences, I want to hear from you guys what you guys want to see and what content is important for you guys to see and any questions you guys may have. So I put a little question on my Instagram story, and Jada Marie 051 has requested for me to do a video on gastroparesis. So that's what this one's going to be. So I know last time I did a video on my CSID, on my diagnosis, and what it is exactly. So let's talk about the other rare disease that affects my life on a day-to-day basis. I have my phone out here because I have some notes, I have some facts that I cannot remember for the life of me. So I will link all my sources below in the description. So let's get started. I have gastroparesis, which essentially means partial paralysis of the stomach, and because I had COVID, it has become almost fully paralyzed. So gastroparesis is a motility disorder, so there is an actual physical dysfunction of that stomach and how food is moving through the digestive tract. So it moves a lot slower, there's a lot more issues with it, and this is caused by many things, including diabetes, any surgeries. Some medications actually make it worse. For me personally, it was because of a surgery I had to put a PEG tube into my stomach because of my CSID, and what ended up happening was part of my vagus nerve was severed, which led to gastroparesis. But I already had some kind of form of gastroparesis is what my GI doctor told me. It was a lot more mild, and then it just worsened. So now I'm dealing with a more severe version of gastroparesis, which I'm learning how to cope with and how to adapt. And then the other part of that is just unknown. Gastroparesis may not have a cause. It may just be idiopathic, and that's okay not to know what the cause is. The important thing is the diagnosis and the treatment. So according to NIDDK, not exactly sure what that website is, but it was a legitimate website that I found, and I found this definition. So gastroparesis is a disorder that slows or stops the movement of food from your stomach to your small intestine, even though there is no blockage in the stomach or intestines. So when I was going through my gastroparesis diagnosis, I was frequently running into the problem where doctors thought that I had a small bowel obstruction or an ileus, which is just any kind of physical obstruction in the digestive tract, which can just be easily detected on a CAT scan or an X-ray. So whenever I was having those symptoms, they send me to go get one done. So I've had a lot of those done. I've been exposed very frequently. And of course, those always come back negative. So we were like, okay, it's not that, so there's something different going on, and we need to run some different tests. So that's what led me down to my journey of being diagnosed with gastroparesis. So gastroparesis, again, like CSID, like IBS, like all of these different GI disorders, has a lot of the same symptoms, but there are a few markers that kind of lead doctors to believe that it is gastroparesis and not anything else, because there are some symptoms that are very unique to this condition. So those symptoms include vomiting, nausea, bloating, abdominal pain, early satiety. I'm not sure if I'm saying that right, but basically you get this feeling of fullness very early in your meal, vomiting undigested food hours after eating, acid reflux, changes in your blood sugar levels, weight loss, lack of appetite, and eventually malnutrition. So a lot of those are frequent in different GI diseases, but the ones that are a little bit off is just the vomiting food, undigested food hours after eating, or feeling full very early, or just lack of appetite. That's what I started to experience, and that's what led to my first hospitalization. I couldn't eat, essentially. Like, I was getting full after a few bites. I would take like 3 bites of chicken and be like, I'm full. What do I do? And then that's what led to me just to get insufficient calories, and eventually led me down the path of malnutrition, in addition to my CSID, which was already making it hard for me to eat. So that's something that I experience, and I know a lot of people who suffer from gastroparesis do experience too. I try not to use the word suffer. I do use it in this context, but I try not to use the word suffer because, to me, having a disability does not include, I mean, like, it can include suffering, but I try to stray away from using that to keep up a positive attitude about it. So I try to use more the context of, like, experience, or just having a disability, or just having gastroparesis, trying to stray away from using this word suffer. But in this context, I'm going to use suffer because this is obviously a very painful and very difficult thing to deal with. So those are some of the symptoms that I experienced as well. I experienced almost everything on that list. And something different is that I experienced the blood sugar levels too. I have never had problems with blood sugar, but once I developed gastroparesis, like the more severe form, I started to notice that I became chronically hypoglycemic. So now I'm checking my blood sugar 4 times a day. I am taking emergency glucose. I've had times where I've had to go to the ER because my blood sugar's just dropped and I don't have any sugar just to get into my body at that point. I know recently my glucose was on back order at CVS, and I had to go to the ER because my blood sugar dropped to like 54 and it was still dropping, and I was like, this isn't normal. So that's one of like the weirder side effects that I was not expecting to have with that, and that's a good marker that it is gastroparesis and not Crohn's or colitis or something else. So the diagnosis for this can be a little bit tricky. There is a hallmark, yeah. There is a hallmark and a staple test that they perform, which is called the gastric emptying study. So basically what that is you go into a doctor's office, you haven't eaten all day, and it is a nuclear medicine test. So what they do is they give you a type of food that is mixed with a radioactive substance, and then we'll see where the food is moving through your stomach. So, and how long it takes. I had mine done back on Long Island, back home, and I went in early in the morning. I was already admitted to the hospital, so it was pretty simple. And I remember getting my blood sugar checked first, and I sat down in this chair with this tray in front of me, and she gave me these egg whites, which had a radioactive substance mixed in, which you actually do not taste at all. It just tastes like regular egg whites, but I don't like egg whites, so it was kind of rough for me. And then you get toast with jam on top of it, and you have to eat that in about 10 minutes, which for someone who was suffering from gastroparesis symptoms was quite difficult. So this was actually before the procedure that I had that put me into severe gastroparesis. But what they do is you eat that in 10 minutes, and then you go into this almost tube-like thing, and then they just do a quick little scan, and then I went back up to my room and just hung out for like an hour, and then had to come back again another hour. They did the scan again, went back up, and it was just back and forth for about 4 hours. My test came back normal because at this point I didn't have gastroparesis. I'm sure if I did it now, it would come back quite abnormal, but I can't do that test right now because I am on a feeding tube. So, had that test done. For most people, that test works very well. Another test that is done is called the SMART pill, which is where you swallow this pill, and it's a little camera, and it actually sees your entire digestive tract from your mouth to the ends, and it's just another way for doctors to see what's going on in your stomach, how long it's taking for it to pass through your stomach. So those are the tests used for gastroparesis. For me, having those tests done now would be quite difficult considering the fact that I don't take anything by mouth. I don't even take water by mouth. So I don't know how they would diagnose it now. I know my new GI doctor in Ohio wants to start doing like another gastric emptying exam, and I'm like, I don't think it's gonna work, buddy. So we'll see how that one goes. But there are actually a lot of treatments for gastroparesis. It is a chronic condition. It is a debilitating condition. There are ways to manage it though. One of those ways is honestly just through taking Zofran or Phenergen or any kind of anti-nausea medication. I live off of them. I get 120 prescribed to me at once, and that lasts me like a month. I live on that. I also live on Gas-X a lot because with this condition you get a lot of abdominal bloating. Like, when I say a lot, I mean a lot. You can search up any picture of someone's gastroparesis bloating and understand why it's such a painful and debilitating condition. So there's that. And then there's a medication called Reglan, which is supposed to just increase stomach motility, get things moving a little bit faster, increasing those muscles. And I tried that. What they don't tell you about Reglan is the amount of drug interactions that it has. So I am on an SSRI for my generalized anxiety disorder, and my doctor did not tell me that I cannot be on both of them at once, and it can actually lead to like very severe complications. So I found that through my own research. So I know they tell you to never research anything medical, just go to a doctor, but I researched it, found it, got myself off of it, and they actually came out with a new form of the generic version of Reglan that goes in your nose, so it bypasses the entire digestive system. But I'm still thinking on that one because there are a lot of side effects that I don't know if I'm comfortable with, so it's like a risk-benefit thing. So obviously a lot of things to think about with this condition. And then there are surgeries that can be done. I know there's a thing called a gastric pacemaker, which is supposed to increase contractions of the stomach. There are other surgeries that I'm not too well versed on and I don't want to speak about because I'm not too well versed on them. But through your own research, I'm sure you can find more information about that. So as far as symptom management goes, there's a lot of different ways that people go about eating. One of those ways is a diet change where you go on a more liquid diet or soft food diet, just because it's easier for those foods to pass through the stomach and just get to the small intestine. They move a lot quicker than solid foods might. That's what I tried originally. It didn't work too well. So the second option is a GJ tube or a J tube or an NJ tube. So the trick in that is the J, because the J describes your duodenum, which is part of your intestine, part like towards the top of your intestines. So they have a tube essentially going into your intestines, bypassing your stomach, so that food is not sitting in your stomach for long periods of time. And it makes it easier for you to get that nutrition and for you to not be malnourished. That's what I have. I have a GJ tube, which I'll make another video talking about feeding tubes at one point, but in the short, it is a tube with two ports. One port goes into my jejunum, and then that's where I do my medications, my tube feed, and my water flushes. And the second one goes into my stomach. It's the gastric portion, which is the J part of that. And that is just used for venting my tube. So if I have any bloating or anything like that, or if I did eat anything and my stomach needs to be drained, I just take a syringe and just go in and just let it all out. So it's a little party trick. I can just get rid of my bloating really quickly. So those are two different ways to be doing that. And then another way that I don't really see too often, but I know people who have it, is through TPN. So TPN is parenteral nutrition. So what that does is it completely bypasses the digestive system and it goes into you intravenously. So if you see anyone who has a port, I know they have a Hickman line that goes right here, or right here. I'm not exactly sure what side it's on, but essentially it is a catheter in your chest that delivers nutrients intravenously instead of through the digestive system. So for people who just have really severe GI problems, that might be a better option. So those are different forms of treatment options. So I just want to speak a little bit about my story. So obviously mine was a result of a surgery, and I ended up on a continuous feed. So I cannot take anything by mouth at all, not even medications, not even water, because it really just does not pass through my stomach. Like I said, my gastroparesis was only mild, and it got a little bit more severe, and after I contracted COVID, my stomach basically went to a standstill. I cannot digest anything. I will have food in my stomach for up to 24 hours. So stuff that I ate, earlier in the day or drank earlier in the day is still in my stomach by the night, which is problematic. Usually food only takes 2 to 4 hours to pass through the stomach into the small intestine. Mine just does not do that, and it just leads to a quite dangerous situation and leads to me vomiting and just being malnourished. So my feeding tube is how I get all of my nutrition, and I cannot be more grateful for it. It has been the best treatment for my gastroparesis. So yeah, that's my story, and that's my little spiel on gastroparesis. So as always, make sure to like, comment, and subscribe to my channel, and go to my Instagram at chronicallysydney and my TikTok at SydneyEds. I will link those all in the description. And as always, stay happy, stay healthy, and stay positive.